Welcome everybody. Today I'm going to talk about 5 stealth infections to remove in order to have superhuman energy. So if you want superhuman energy, you have to remove these 5 stealth infections. All right, so today we're going to talk about if you're in the right place, if this talk is for you, who I am. We're going to talk about how to achieve superhuman energy, what the energy drains are, stealth infections and your energy, how to determine if you have a stealth infection, and we're going to conclude. Okay, so this talk is for you if you want to achieve superhuman energy, but you're currently struggling with fatigue and brain fog, and you just can't seem to get over it. Usually, you've been to a number of practitioners, you've tried a number of protocols, and you're not getting to where you want to go. Sometimes it can be a stealth infection. If you've seen multiple providers and you haven't found resolution of your symptoms, if you have weird or mystery symptoms that providers haven't been able to diagnose or treat adequately, and if you've been diagnosed with Lyme or a Lyme type co-infection and you're not getting resolution to your symptoms. So who am I? I'm a 10-year expert in resolving fatigue. I did so for myself and thousands of others at this point. I'm the #1 best-selling author of the book Fix Your Fatigue, the 4-step process to resolving chronic fatigue, achieving abundant energy, and reclaiming your life. And I am the creator of the Fix Your Fatigue programs. I've lectured on 30+ stages, podcasts, and summits, and I'm on a mission to help 1 million exhausted high achievers unlock unlimited energy so they can achieve new levels of success in every aspect of their lives. I'm also a competitive singer, musical lover, dancer, traveler, father, and husband. And that list sounds quite exhausting. I'm also imperfect. So, how do you achieve superhuman energy? So, in order to achieve all the energy that you could possibly want, you have to understand the things that drain your energy, okay? AKA the things that cause fatigue. So, and by understanding these things, you can then know how to achieve superhuman energy. I hope that makes sense. And so what I've found is that it really is all about the causes or the areas of imbalance. And that once you find those things that are out of balance, that are causing low energy, that are causing fatigue, you can reverse those, and that's when you get amazing energy. Okay? And so these causes, these energy drains, can be grouped into deficiencies and toxicities. So deficiencies are things that are not in the body that are supposed to be, and toxicities are things that are in the body that aren't supposed to be there. Okay? So what are the deficiencies? We're talking about hormonal deficiencies like the adrenal gland, which is responsible for our stress management, thyroid, estrogen, progesterone, so these are our sex hormones, testosterone, mitochondria, which is the energy center of every cell in the body except for red blood cells, and produces about 70 to 80% of our energy. So very important. And then vitamins and minerals like B12, folate, vitamin D, iron, magnesium. There's lifestyle deficiencies, so not enough sleep, not enough water, not enough good food. So if you're eating crap food, not enough movement, and then deficiencies in neurotransmitters, and then a deficiency in immune tolerance, meaning that the immune system is not functioning correctly. Okay? Then in terms of toxicities, these are things like molds, heavy metals, chemicals, and these stealth infections that we're going to talk about today. So Borrelia, Burgdorferi, Ehrlichia or Anaplasma, Babesia, Bartonella, Epstein-Barr, and other viruses. Sinus infections, intestinal infections, so these are other infections, dental infections, food allergies, inhaled allergies, negative emotions, electromagnetic frequencies, and then some conventional causes which can get ruled out by your primary care doc, heart disease, lung disease, obstructive sleep apnea like nasal airway compromise, cancer, hepatitis, those are kind of the main ones that we find conventionally. Okay? And that was my story. So my story was I had chronic fatigue for 5 years and just about destroyed my life, destroyed my business. It was awful. And I had almost every single cause of fatigue and brain fog. And I suffered for 5 years. And I would get a little bit better with every cause that I treated, but it wasn't it was only going through and finding all of the causes and treating them in the right order that I truly found resolution to my fatigue, and I was able to achieve superhuman energy, or the best energy of my life. So this is what I see over and over, time and time again in my clients, and this is why I'm on a mission to help 1 million people. Okay, because I don't want anybody to suffer the way that I did. Okay, so I have never met anyone who's found all of their energy drains, all of those causes that we just mentioned, treated them correctly, and wasn't able to achieve superhuman energy. Okay, so essentially, it's a very simple process when you break it down simply. It's all about, if you can find the cause, if you can find the problem, right? This is the way it is with everything, whether you're fixing your car or whether you've got a human resources issue at work. Like if you find the problem and you fix the problem, then the problem goes away, right? This makes sense, right? So if we know whether it's a deficiency or a toxicity, and we can find the problem and we can remove it, then the problem goes away. Okay, so what does this have to do with stealth infections? Okay, we're going to talk about the big 5 stealth infections, okay, which are the Borrelia, Ehrlichia, Babesia, Bartonella, and Epstein-Barr virus that you see over there on the left. Okay, so the reason why I'm talking about stealth infections is because stealth infections decrease your energy by causing many of the deficiencies that we just looked at. Okay, so it causes hormone dysfunction. It causes mitochondrial dysfunction. It causes deficiencies in vitamins. It causes sleep problems. It causes dehydration. It makes you tired so that you're not moving. Okay, all of those things, and pretty much most of these deficiencies, are actually caused by the toxicities. Okay. And so it's very important, if you want to optimize these things, and if you know that optimizing these things are going to bring you the most amount of energy possible, which is true, then you know that removing the toxicities is where it's at in order to free these up and allow these to come back into balance. Okay? And by affecting all of our human systems. So these stealth infections decrease your energy by causing many of these deficiencies, and then also by affecting all of our human systems. Okay, we're talking about the endocrine system, the circulatory system, the respiratory system, digestive, so you can go down this list and see musculoskeletal, mitochondrial, integumentary. So all of these systems are affected by these stealth infections. So it's no wonder why if you have these infections that you're not going to feel well and you're going to be tired, right? And so this is important because you cannot achieve superhuman energy if you have a stealth infection that you haven't addressed. Okay? So I know there's a lot of awesome lectures happening right now in this summit, the Superhuman Energy Summit. And so my proposal, or what I am proposing here, is that all of those talks are amazing and super duper important, but if you have an infection, you're not going to be able to achieve the energy that you want. And like I showed with all of these deficiencies and toxicities, it's actually important to address all of them. It's like you have 33 nails in the bottom of your foot. That's all the number of causes that we just looked at with deficiencies and toxicities. And most people don't have all 33. I had like 27 of them, but most people have 20 when they have significant fatigue. And so you have to pull out every single one of those nails if you really want to take it to the next level and not just resolve your fatigue, but achieve superhuman energy. Okay? So how do you know if you have a stealth infection? Okay? So we always want to look at a combination of things, look at all the data we have. So we want to look at symptoms, physical exam, laboratory tests. And so the laboratory tests that we're going to look at are called PCR tests, as well as serology tests. But ideally, we're looking at your symptoms plus physical exam or signs that you have plus laboratory testing. Okay, that's all the data that we have the potential to have. Okay, so let's talk about serology tests. So can we use serology tests? So this is a 2-tiered test that is supposed to be completed by what's called an ELISA and a Western blot test, but it's actually only meant to be used in health departments for epidemiologic studies. Okay, the CDC has actually stated on their website that it was never meant to be used in clinical practice, and they're not very accurate. Okay, in fact, in 2005, a Johns Hopkins University study found that the CDC's two-tiered testing method actually missed as many as 55% of positive Lyme disease cases. So the serology test is looking at the immune system's reaction to the bug. Okay, and so if you're looking at the immune system's reaction to the bug, if the immune system isn't working right, guess what? The test doesn't work. Okay. Here's another study from the NIH that was published in 2008 and looked at approximately 3,600 people who had Lyme disease. Only 36 of them met the CDC criteria by an IgG Western blot. So this represents just 1 out of 100 cases. Okay, so not very accurate. And like I said, it depends on an intact immune system. If someone has any of the usual suspects that I talk about, the toxicities that we mentioned in a previous slide, heavy metals, chemicals, molds, other infections, etc., or a history of antibiotic use, their immune system is probably not working right and the testing is less accurate. Okay, and we're also now seeing hundreds of species for each of these organisms, and we don't have disease like each species specific. So for example, if we're talking about Borrelia and we're looking at 100 different species of Borrelia, the blood test, the serology test, the look at the immune system reacting to the bug is only looking at Borrelia burgdorferi. So if somebody has another form of Borrelia, it's not going to be picked up on this test. Okay, so let's talk about PCR tests. So a PCR test is like looking at the DNA of the bug, of the infection. Okay, but in the blood, unfortunately, it's very hard to find because they can hide in tissues. A PCR test in the urine is actually the best test, but you do need to provoke it by pushing the infections out of the lymph system by doing exercise or getting a lymph massage. But once again, we're now seeing hundreds of species for each of these organisms, and we don't have the technology to test for every single one of them. Okay, the PCR test actually is broad spectrum, but unfortunately it's $650, so it's not accessible to everybody. Okay, so then can we use symptoms? And the answer is yes. Okay, and even according to the CDC on their website, Lyme disease is diagnosed based on symptoms, physical findings like a rash, and the possibility of exposure to infected ticks. Okay, so symptoms are really the most important diagnostic tool that we have. And in fact, when I was in conventional medical school, I learned that 90% of everything that I'm going to need to know about the patient comes from their subjective experience, which is basically their symptoms and the history that they're reporting to me, and then the rest are labs and physical exam. Okay, so symptoms are the main way to go, but they require a good historian. So the patient or the client has to be able to pay attention to their symptoms and changes over time. They have to understand the chronology of how things happened over time and when things get better and worse. You need a provider who can recognize the symptoms and make appropriate recommendations based off of them. And we're going to talk about what the symptoms are for specific infections in just a minute. You need to have good communication, so you need to be able to communicate about updates and changes over time. You do have to be open to lab testing to support what you're seeing and experiencing. And you also have to be open to learning more in this ever-evolving field as infections mutate and expand their reach. Okay, so this is both for you as the patient or client, as well as for the clinician. Okay, so what symptoms are indicative of a stealth infection? Well, problem sleeping, fatigue, cognitive dysfunction, so brain fog or memory loss, urinary symptoms like pain with urination, urinating at night, getting up multiple times during the night, having to pee all the time, which is urinary urgency, or urinary frequency, meaning you have to pee all the time, and urinary urgency is when you think about peeing, you gotta go pee. Temperature changes, like cyclical fevers, like maybe every week or every 4 days you're soaking the sheets at night, or you're getting a fever at night, maybe every 4 months, maybe every 1 month. So it just happens every cycle. You may be sweating at night, just at night, or you may be sweating just during the day, or both, night during the day. And then also feeling cold in the hands and the feet. So you may also have muscle pain, so neck pain, low back pain, headaches, muscle cramping, especially in the calves and the feet. That can be indicative of certain infections. You may have joint pain that moves around the body, or joint pain that doesn't move around the body. in the knee, the foot, the hands, the hips, the shoulders. You may have mood issues like depression, anxiety, panic attacks. Some of these infections are associated with mood so bad, anxiety to the point of panic attacks, and depression sometimes to the point of suicidal thoughts. You may have neuropathies, so basically numbness, tingling, shooting, electrical pains. And you may have hormonal deficiencies, like I mentioned, adrenals, thyroid, and sex hormones. So how many of you have any of these symptoms, right? If you don't have ideal energy, then it is very possible that you may have one of these infections. It's just kind of underlying, and that you're wondering, oh, that's just a muscle cramp that I get every once in a while when I exercise or when I cramp my calf too tightly, and it goes away with magnesium or goes away with potassium or goes away with more water. And in reality, it probably is one of these infections. So let's differentiate these symptoms by infection. Okay, and we'll play that name that infection game. Okay, so infection number one we're going to talk about is will cause the symptoms of fatigue. Symptoms will come and go, so you'll have good days and bad days, and that might be today is a good day, but tomorrow is a bad day, or it might be one day a week is a good day. Symptoms that move around the body, so this is joint pain, muscle pain, or nerve pain that moves around the body. So maybe it moves around by the hour, maybe it moves around by the day, or maybe it moves around by the week. Okay? And then a rash that sometimes gets worse around your menses. Okay? So this is Borrelia burgdorferi. Okay? This is the causative agent for Lyme disease. It's the most common vector-borne disease in the United States, over 95% of all vector-borne illness, and up to 300,000 cases per year now. Found in 1975 in Lyme, Connecticut, with 12 cases of juvenile arthritis were reported, and Dr. Bergdorf went he was a pathologist who went and figured it out, so he gets to name it. It's transmitted by the Ixodes scapularis tick. It's considered underreported due to lab testing deficiencies, and it can morph into 3 different forms, which can be cell wall deficient, a cyst, and a spirochete, which is shaped like a spiral. Here's infection number 2. So with this, you can have a high fever, you can get a headache, you can get fatigue, you can get musculoskeletal pain, which means muscle pain and skeletal pain, or bone pain. And the big thing here, because the other symptoms are pretty nonspecific, is lab test abnormalities. So often you're going to get low white cell count, you're going to get a low platelet count, and then you're going to get elevated liver function tests. Okay, so this is Ehrlichia or anaplasma. Okay, even though rickettsial infections like Rocky Mountain spotted fever or Q fever may look similar. Okay, this was first recognized in the late 1980s, reported first in 1999 to the CDC, transmitted by a tick bite, mainly the Lone Star tick in the southeastern and south central U.S., obligate intracellular bacteria, and mainly animals since 1935. That's where it's found. Now, what's important to note is that you don't have to just get these from a tick. You can get these, we're finding that a lot of it comes from through the placenta from mom at birth. A lot of it's being transferred, and then it takes a number of stressful events in your life in order to upend your immune system, and then the infections become opportunistic. But you don't have to get a big inoculation from a tick. You can also get it from anything that takes a blood meal. So that might be chiggers, that might be sandflies, that might be mosquitoes. So there are a number of those bugs that can kind of transfer from animal to animal. And then, of course, like I said, it can be vertically through the placenta, and then it can be through sexual activity. Okay. Infection number 3. So symptoms include day sweats, somebody who runs hot all the time, night sweats, chills, air hunger or a shortness of breath where you can't catch your breath, a cough that cannot be explained, fatigue, abdominal pain, diarrhea, anxiety and panic attacks, depression and suicidal thoughts, this is the one I was talking about, and awful insomnia. So you don't have to have all of these things, but generally if you have a few of them, it can be indicative and it warrants doing a trial treatment. It's Babesia. and it will make Lyme symptoms 3 times worse. It is a malarial type organism, so it's inside the cell. There's hundreds of species, and it has reached epidemic levels in New Jersey. It's found in 66% of ticks. I grew up in New Jersey. Interesting fact about me. So infection number 4 can give you some of the following symptoms. Cold hands and or feet. So if thyroid is fixed, you can't give somebody any more thyroid and they're still cold, you definitely have to think about this infection. They'll get occasional fever, so not as often usually as babesia, but can still get occasional fever, and it might be cyclical. Fatigue, soreness or sharp pains on the soles of the feet, sharp shooting knife-like headaches, joint pain, usually in a single joint, and it doesn't move around the body, muscle pain that is severe, neck pain, low back pain, bad sleep, stretch marks, muscle cramps, usually in the calf, but can be elsewhere, or very tight muscles, low thyroid, anxiety, depression, high blood pressure, and Raynaud's, which has to do with a spasm of the blood vessels that decreases blood flow and makes you have cold hands and feet. This is Bartonella. Okay, this dates back 4,000 years. It has several forms. It is slow growing. It's transmitted through cat or rat fleas, lice, mosquitoes, ticks, and sandflies, cat bites and scratches. There's actually something called cat scratch fever, which is acute Bartonella that causes big lymph nodes near the spot where you get scratched. But then you can get chronic, and upwards of 50% of all domestic animals actually have Bartonella. Okay, so your dog or cat, if you've been licked in the face, it's very likely that you have Bartonella if you didn't get it from your mom or in some other way. There's more than 50 species, approximately 9 infect humans, mainly occurs in the fall and winter. Okay, infection number 5. So this is the big 5, number 5 of the big 5. Fever, swollen lymph nodes, fatigue, memory loss, brain fog, a high white blood cell during its acute phase and a low white blood cell during its chronic phase, high lymphocytes and monocytes in the chronic infection phase. So these will be on labs. Sometimes you'll get low neutrophils on lab testing as well. So this is Epstein-Barr and other viruses. Okay, Lyme disease patients may have strong viral activity, including herpes, cytomegalovirus, Epstein-Barr virus, or mononucleosis, or West Nile. So interestingly, you can actually get a mononucleosis from cytomegalovirus as well, not just from Epstein-Barr virus. And they travel with these other infections because it's all about balance. And if the immune system is not keeping these bugs in check because it's distracted by the heavy metals, chemicals, and molds, then a number of these bugs will come out. So it's very common for people to also have herpes outbreaks during this time. Viruses are heavily involved in autoimmune diseases and chronic fatigue. One of the most overlooked aspects in chronically ill patients is a virus. And viruses can have chronic activity without visible signs. We all know right now the coronavirus is going on, and we all know how devastating that is, and that is a virus. So hopefully at this point you have a better idea now of which infections you may have, which can definitely, once you have that knowledge, then you can target with laser-like efficiency on which bug you have, and that's going to make a big difference in your energy and allow you to achieve superhuman energy. So in conclusion, so if stealth infections cause multiple deficiencies like we talked about, and we know that each deficiency can cause low energy, then we know that removing stealth infections will help with multiple deficiencies and allow for superhuman energy, because you remove that infection and that's going to allow all those deficiencies to be resolved somewhat. I mean, you still have to replace them, but it'll make your hormones better, it'll make your mitochondria better, it's going to make your sleep better, all those sort of things. And so hopefully I have made my case that by resolving these infections, you're going to be able to achieve superhuman energy. So thanks so much for listening. I hope you have an amazing day.